Before we begin the presentation, a note on the current situation. We recognize that this is an unprecedented time, and as such, contractors participating in Efficiency Vermont programs are required to comply with all applicable local, state, and federal laws, rules, regulations, actions, orders, and directives of any authority, including, but not limited to, health and safety regulations such as OSHA and VOSHA requirements, and public health restrictions such as the governor's executive orders related to the COVID-19 pandemic. Our first priority is the safety, health, and well-being of our staff, customers, and partners. Here is a list of resources available to support your business's compliance at this time. Office of Governor Phil Scott's Executive Orders, State of Vermont Agency of Commerce and Community Development Sector-Specific Guidance for Businesses, World Health Organization's Guidance for Employees and Workers, U.S. Department of Labor, Occupational Safety and Health Administration Guidelines on Preparing Workplaces for COVID-19. We will remind you of these resources and provide information on accessing the resources at the end of the presentation. Welcome to the Introduction to Indoor Air Quality Module 3, Training from Efficiency Vermont. I'm Laura Capps, and I'm excited to walk you through this course. This training is intended for Efficiency Excellence Network members. If you've not reviewed Modules 1 and 2, you may find those at the same location as this module, and we encourage you to watch those first. We'd like to thank South Face Energy Institute, the National Healthy Homes Training Center and Network, and the U.S. Center for Disease Control and Prevention for images used in this presentation. Efficiency Vermont provides this presentation for informational purposes only. Efficiency Vermont does not claim this presentation to be all-inclusive nor exhaustive with regard to the subject matter. It is not in the purview of this presentation to address specifics of a particular home or environment, or to provide guidance on diagnosing or treating occupant health problems or occupants' building-related illness. The content of this presentation shall not be considered legal or medical advice or a substitute for consultation with a licensed physician or an attorney. Individuals, companies, and organizations that wish to use any content from this presentation shall obtain permission from Efficiency Vermont prior to use and consult their own legal and medical professionals. This presentation is not intended to create, and the receipt of it does not constitute, a physician-patient relationship or an attorney-client relationship. It is the user's and the recipient's responsibility to follow all applicable federal, state, and local requirements and to use good judgment in using this presentation. All questions regarding this presentation should be referred to Efficiency Vermont staff. This course is broken into 3 modules. Module 1 describes the common indicators of poor indoor air quality, identifies common pollutants and situations that cause poor indoor air quality, and explains low-cost techniques for quantifying poor indoor air quality. Module 2 lists in order of priority the steps for improving indoor air quality and common strategies used. Module 2 also takes a deep dive into ventilation. Module 3 provides tips for knowledgeably talking with customers about the customer's indoor air quality, recommendations for improvement, and relevant Efficiency Vermont offerings, and explains the EEN Healthy Home Contractor trade group and how to join. This course is an introduction to indoor air quality. Those interested in diving deep should check out the information provided in Module 3 regarding the Efficiency Excellence Network Healthy Home Contractor trade group. This recording covers Module 3. Let's get started with Section 1, Defining the Problem. Discussing indoor air quality with customers takes skill, especially when the problem they perceive they are having is not the actual problem in the home, as is often the case. You'll likely need to provide them with some education, which takes time, but time costs money. How you say things is important to avoid putting yourself and your business at risk. And of course, you want to be sure you don't offend them somewhere along the way. A silver lining to COVID-19 is that it's increased people's awareness of indoor air quality and the importance of fresh air ventilation in buildings. So hopefully you'll need less time to explain this to the customer. Now the key is making sure they don't feel threatened by you while you are in their space, and figuring out how to effectively use your sense of smell through a face mask. Following national and state protocols when engaging customers in person is paramount to managing your risk at this time. All indoor air quality investigations are best started with a customer interview. The questions you ask during the interview are dependent on the reasons the customer called you in the first place and the observations and data you've collected thus far. From the standpoint of customer communication, the goal of the interview is to determine what your customer is trying to accomplish or what work they need to get done. An understanding of what causes the customer pain in trying to get this work done or what prevents them from doing it, and what the outcome would be if the customer successfully completed the job, and what the benefit of that outcome is to the customer. Only after knowing the answers to these questions can you effectively communicate to the customer how your proposed solution will relieve their pain and create value for them. Identifying the customer value proposition and aligning your services to deliver that value is called value proposition design. One tool for doing this is the Value Proposition Canvas, created by Strategizer and available for free at the website provided on this slide. While this graphic may seem intimidating at first, working through the sample questions Strategizer provides with the tool makes application straightforward and easy to use. With a little practice, this process becomes second nature. Failing to align your solution to meeting the customer's true pain points in a way that supports them accomplishing their desired jobs and achieving the value they seek will lead to costly callbacks and negative reviews. Now, from the standpoint of identifying the root cause of the indoor air quality issue in a home, the goal of the customer interview is to learn as much as you can about the conditions in which the air quality problem is experienced. It's great when those conditions are being met while you're in the home and you can experience the issue firsthand. But even then, you may not have the fortune of getting to see the entire picture. As discussed in Module 1, indoor air quality is complex and can be impacted by a multitude of factors. Each person has different triggers that cause them to notice changes in air quality, so you may need to interview multiple occupants. Sometimes it's best to interview occupants together. Other times, it's best to do it separately due to conflicting views or relationship issues. Asking good questions is a skill of its own, and when it comes to indoor air quality, tone really matters. Remember, some people like the smell of home and don't realize that's an indicator of poor IAQ. In refining your inquiry techniques, consider how it will sound in the moment and how it will sound later on in reflection. My best way for describing this is through a question. Have you ever had an interaction with someone where in the moment you felt very relaxed and engaged, but later you felt like they were pulling something over on you or dancing around the main point? Yeah, you don't want your customers having that feeling once you've gone. Here are a few tips on asking good questions for the purposes of indoor air quality investigations. First, ask open-ended questions. Many customers know more about air quality than they realize, and asking open-ended questions can help them identify underlying problems and possible solutions that are more likely to work for their situation. Number 2, come from a place of genuine curiosity. Resist the urge to think you know the problem before you fully identified the customer value proposition and thoroughly investigated the conditions in which the problem occurs. Number 3, be relatable. When it comes to IAQ issues, people are often sharing very private information with you. Build trust by relating and sharing back. This will also build customer confidence in your ability to solve the problem. Number 4, really listen to the customer. This is one that I struggle with the most. After being in so many homes, I always assume I know the issue and in thinking through a solution before finishing the interview. Inevitably, I miss something that the customer says which is critical to the customer value proposition. Clear your mind and listen to the customer. There will be plenty of time for you to develop your own thoughts about the project when you aren't actively talking with the customer. Number 5, follow general questions with specific ones, focusing on one thing at a time while only asking essential questions to keep it simple. Interview fatigue is real, especially now that people are less comfortable with being social. And number 6, remember to smile sometimes. Smiling can be a challenging one for Vermonters because many Vermonters don't really smile. I know I've had to trade my goofy southern grin for more conservative smile to avoid throwing people off. As with all of these tips, use your own discretion when choosing when to smile, but remember, a smile can be contagious, and a larger than normal smile may be needed if you're wearing a mask so it's discernible through your eyes. The topic of the questions you ask will vary based on the IAQ issue at hand. In general, though, you'll want to be sure to cover the following at a minimum. Seasonal and daily variances. Does the issue change with the weather, and if so, how? What about throughout a given day? Behavioral variances. What activities impact the issue and how? Locational variances. In what parts of the building is the issue better or worse? And external factors. What, other than weather, is going on outside when the issue is better or worse? In the next section of this module, we'll cover the Building Performance Institute's Healthy Home Evaluator certification. In earning that certification, you'll learn in depth how to methodically assess a home for IAQ and interview the customer as part of that. In communicating your findings to customers, be very aware of their body language and use all of the clues you've gathered thus far in your interactions with them to deliver the message in a way that they'd want to hear it. Not everyone actually wants to be treated the way you want to be treated, so the golden rule does not apply here. You want to meet the customer where they are going to be the most receptive to what you have to tell them. For some, this is being very direct and to the point. No sugarcoating is needed, and in fact, the sugar would make them trust you less. Others may need visuals to help them take in what you're saying, photos of the problem at hand, or a brochure showing the proposed solution. Some may need all of the details to really understand the full picture. Be ready to tell them exactly when, where, and how the solution will be installed, while others will only be able to take small steps and will be very sensitive to anything that feels like pressured decision-making. It's common to have more than one person making the final decision about whether to move forward with a project, and in those cases, you'll need to play to both personality types. There are numerous tools available to teach you more about communicating effectively with customers. One to consider is the Everything Disc model shown on the screen. You can use this for yourself and your staff, as well as apply it when communicating with your customers. Our last note on communication is to manage your risk by never making affirmative statements related to indoor air quality and customer health. Because of the dramatic, acute, and long-term impact indoor air quality can have on health, it's natural for customers to want to discuss health during an indoor air quality conversation. However, there are very strict and clear requirements when it comes to discussing an individual's health that you do not want to cross. Never ask a customer about their health. If a customer volunteers information about their health without your prompting them, do not document that information. If a customer has questions about how their indoor air quality is impacting their health, recommend the customer speak with their healthcare professional and encourage the customer to provide that healthcare professional a copy of the documentation you deliver as part of your investigation. Never provide the documentation directly to the healthcare professional unless you have a consent form in place that represents you, the customer, and the healthcare professional that your and the healthcare professional's legal teams have reviewed and the customer has signed. You can provide peer-reviewed research that demonstrates the connections between health and indoor air quality and how your proposed solution will address those air quality issues. Be very deliberate in what you say and never imply that your solution will improve someone's health. For more information on how to manage risk when delivering indoor air quality services, join the EEN Healthy Home Contractor Trade Group. We'll review how you can do this in the next section. In summary, when it comes to customer communication, the first step is to define the problem. You do this by working through the customer design value proposition during a customer interview. The customer interview also expands your knowledge of the indoor air quality situation beyond what you can see during your visit to the building. Ask good questions that will facilitate getting the right information from the interview and building a solid relationship with the customer. Delivering your proposed solution to the customer using their preferred communication style will make them more receptive to moving forward with a project. Finally, focus on presenting peer-reviewed research that documents connections between indoor air quality and health while avoid discussing the customer's specific health concerns. Now, let's talk about getting referrals and ways Efficiency Vermont can support you and your customers in achieving good indoor air quality. Efficiency Vermont recently launched the Healthy Home Contractor Trade Group within the Efficiency Excellence Network. Healthy Home Contractors hold the Building Performance Institute Healthy Home Evaluator credential, are members of the EEN Home Performance Trade Group, have taken Efficiency Vermont's online Healthy Home Program Procedure Training, and have signed the Program Participation Agreement. To become a BPI Healthy Home Evaluator, a contractor must be an active BPI Building Analyst, Multifamily Building Analyst, Energy Auditor, or Quality Control Inspector, and pass an online exam. To become a member of the EEN Home Performance Trade Group, a contractor must have $1 million in general liability insurance and have someone on staff with an active BPI Building Analyst certificate. To begin the application process, please contact us. Every EEN Healthy Home contractor receives an indoor air quality monitor to keep. The monitor tracks humidity, temperature, particulate matter, and carbon dioxide. Additional monitors and other diagnostic equipment are available for free rental from Efficiency Vermont by EEN members to support energy efficiency project development. EEN contractors may offer their customers an air quality monitor loan through Efficiency Vermont. Interested customers will receive a monitor like the one shown on this slide from Efficiency Vermont in the mail. The goal of the monitor loan is to motivate behavioral and energy efficiency improvements. The customer keeps the monitor for 2 weeks and then returns it to Efficiency Vermont in prepaid packaging. Efficiency Vermont generates a report for the customer and contractor showing the amount of time the air quality did not meet recommended specifications. This information informs healthy home contractors providing healthy home energy assessments. The monitor may also be used to verify changes in indoor air quality after project completion. EEN Healthy Home Contractors are searchable in the Find a Contractor tool on the Efficiency Vermont website. When Efficiency Vermont receives customer inquiries regarding indoor air quality, we refer those customers to the EEN Healthy Home Contractor listing. As you already know, indoor air quality calls have dramatically increased since COVID. Doctors may now refer patients to Efficiency Vermont for air quality monitor loans and free Healthy Home Energy visits. When projects are identified during the Healthy Home Energy visit and customers are open to a contractor referral, Efficiency Vermont refers them to EEN Healthy Home Contractors and provides their selected EEN Healthy Home Contractor with the results of the indoor air quality monitoring and the Healthy Home Energy visit. In addition to the EEN Healthy Home Contractor Trade Group, Healthy Home Energy visits, and Indoor Air Quality Monitor Loan Program, some of the Efficiency Vermont programs directly supporting indoor air quality include home performance, building performance, high performance new construction, and other air sealing and insulation offerings, ventilation systems for rental homes and businesses, room air purifiers, dehumidifiers, wood stove changeout, custom project support for businesses, and financing through the Home Energy Loan and Business Energy Loan that can be used to improve indoor air quality. Note that these programs are available at the time of this recording. For accurate information, visit the Efficiency Vermont website. We're really excited you've taken the time to hear our tips on talking with customers and programs that we have to offer. We hope you'll consider joining the EEN Healthy Home Contractor Trade Group. Regardless of your EEN membership, we are here to help and hope you will give us a call if you have any questions at all. This concludes Module 3 and our 3-part series on indoor air quality. It was fun creating this training for you, and I look forward to receiving your feedback on how we may improve the course the next time we record it. For more information about the resources we've covered and to provide feedback about this training, please contact us using the information on the screen. Thank you for taking the time to watch this presentation. Together, through efficiency, we will make Vermont homes safe, affordable, comfortable, durable, and resilient, resulting in an improvement in population health and a reduction in greenhouse gases. As noted in the beginning of the presentation, this slide provides a list of resources that we encourage you to visit so that you can learn more about how to comply with all applicable local, state, and federal laws, rules, regulations, actions, orders, and directives of any authority, including, but not limited to, health and safety standards and public health restrictions related to the COVID-19 pandemic. The links on this slide are active. To access them, download the slide deck from the webpage where you access this training recording. Thank you.